Number 102. What warning should you give to a client about the use of alcohol while taking metronidazole, a medication from Flagyl, for the treatment of intestinal or vaginal infection? The answer is, the warning you should give to a client while taking metronidazole is, don't drink alcohol. This is because it gives you a reaction similar to disulfiram. The drug reacts with alcohol and makes you feel sick. My answer is, the warning you should give to a client while taking metronidazole is, don't fucking drink alcohol. They can fucking wait. This is because it gives you a reaction similar to disulfiram, which will have you all fucking sick. 103. When should metronidazole, a medication from Flagyl, be given? AC or PC? The answer is, metronidazole, which is a medication from Flagyl, should be given 1 hour before or 2 hours after a meal. This will prevent gastric discomfort. My answer is metronidazole, which is a medication from Flagyl, should be given PC, which means after a meal. But just in case, put 1 hour AC or 2 hours PC, which means after a meal. This will prevent gastric discomfort. Number 104. What is the difference between active and passive immunity? The answer is, active immunity is, a person forms their own antibodies. Passive immunity is, a person receives antibodies from others, like breast milk. My answer is, passive immunity is past. The person receives ready-made antibodies from the serum of others. Baby gets it by sucking breast milk. Active immunity is when a person is exposed to antigens. Then the fucking body starts forming them. Number 105. How is passive immunity obtained? The answer is, passive immunity is obtained from the administration of immune globulins. My answer is, the person receives ready-made antibodies from serum of others. Baby gets sucking breast milk. Number 106. What is a toxin and what is a toxoid? The answer is, toxin is a poisonous substances produced by some bacteria, and toxoid is a killed or reduced toxin capable of stimulating antitoxins. My answer is, it's exactly as it fucking sounds. Toxins are poisonous and come from bacteria. They can help out in tiny portions but will poison your ass if you take too much, so hold your horses. And toxoids are already killed or reduced toxin that is capable of stimulating the formations of antioxidants, which is an antibody formed. Number 107. What are some side effects to vaccines and toxoids? The answer is, some side effects to vaccines and toxoids are, fever, rash, and aching of joints should subside within 48 HRS. Subside means to become less strong or intense. My answer is, some side effects to vaccines and toxoids are, when you get vaccines or toxoids, your ass might catch a fever. You might have a rash and even your joints are gonna be aching. And to top it off, that shit is going to subside within 48 hours. Subside means become less strong. Subside means sub or under, meaning the pain bitches down. Number 108. When should live virus vaccines not be given? The answer is, live virus vaccines should not be given when the person is pregnant, or has an immune deficiency. My answer is, live virus vaccines should not be fucking given when she pregnant or has immune deficiency. That is a no-no. Number 109. What nursing responsibilities are required prior to administering immunologic agents? The answer is, the nursing responsibilities that are required prior to administering immunologic agents are, check allergies of patients and check vitals. My answer is, it is fucking simple. The responsibilities are to check for allergies and check vitals. How are you going to give some shit and not see how their vitals are doing, and on top of that give him some shit he is allergic to? Get a hold of that medical record, my boy. Number 110. What intervention should you take to prevent Rh hemolytic disease, kernicterus, after birth, and when should you administer it? The answer is, RhoGAM given within 72 hours after birth to women to suppress antibodies against Rh factor. My answer is, to prevent Rh hemolytic disease, kernicterus, after birth, you gotta let the homie RhoGAM handle his shit. The fucker will suppress antibodies against Rh factor. Just gave that foo 72 business hours and he will handle it. RhoGAM ain't playing games with Rh factor, he'll get em suppressed. Number 111. What instructions should you give to clients and families who are being immunized? The answer is, the advice to give clients and families who are being immunized are those traveling to foreign countries should contact a doctor before traveling. They should discuss risks associated with vaccines, and keep patients close for 30 minutes in case of adverse reactions. My answer is, the best advice to tell the family is to get a hold of a fucking doctor and have him discuss risks associated with vaccines. Then keep the patient close for 30 minutes cause you don't want those bitch ass adverse reactions, gang. Number 112. What topical medication is used in the treatment of viral skin infections such as herpes? The answer is, the topical medication that is used in the treatment of viral skin infections such as herpes are acyclovir, The brand is Zovirax. You can also use valacyclovir from the brand Valtrex, and amantadine from the brand Simitrel. My answer is to remember these topical medications that are used in the treatment of viral skin infections such as herpes, which are acyclovir. The brand is Zovirax. You can also use valacyclovir from the brand Valtrex, and amantadine from the brand Simitrel. Just listen fucking carefully. They both end in lovir and the other one is amantadine, so it has to do with some love shit to treat herpes, which is how it got there in the first place. And for the brands which are Zovirax and Valtrex, just remember that a T-Rex got herpes, so that Trex needs love again and is going to need amantadine from Simitrel. And acyclovir and valacyclovir, they both end in lovir. Remember that shit, cause they were on some lover shit which led top herpes and now they need lovir to get the fuck out of it. Number 113. What antiseptic germicide have you used in sterile procedures in the skills lab? The answer is, the antiseptic germicide I have used in sterile procedures in the skills lab is betadine. My answer is, the antiseptic germicide I have used in sterile procedures in the skills lab is betadine. Betadine be sterile up in that hoe. Betadine was used by me left and right in sterile procedures. No motherfucking cap, Betty. I meant betadine was used in sterile procedures at all times. Number 114. What is the antiseptic germicide that should not be used if allergic to shellfish? The answer is, the antiseptic germicide that should not be used if allergic to shellfish is betadine. Betadine is a form of iodine. My answer is, betadine should no be fucking taken if you are allergic to shellfish. So think that betadine needs tiacute beta. Get the fuck out of there. Betadine is an iodine. Number 115. What is the action to take during and after applying betadine to skin? The answer is, the actions to take during and after applying betadine to skin are checking for allergies, use gloves, apply as directed, and do not keep at bedside. Be careful with betadine cause that shit is powerful and it can stain your skin, your clothes, and even your fucking skin. So use rubbing alcohol to avoid staining your shit. Number 116. What are symptoms indicating an inflammatory response? The answer is, symptoms indicating an inflammatory response are burning, swelling, itching, irritation, and redness. My answer is, the symptoms indicating an inflammatory response are obviously fucking painful. It is inflammatory, therefore it is going to be burning, swelling, itching, irritating, and have redness cause it fucking burns. Number 117. For what kind of skin conditions are topical enzymes used? The answer is, topical enzymes are used for second and third degree burns and pressure ulcers. My answer is, when you hear topical enzymes, just remember top, meaning they cure and go on top of second and third degree burns and pressure ulcers. Think of it as adding pressure since it is top ical. Number 118. What interventions should be done prior to using topical enzymes? The answer is, the interventions that should be done prior to using topical enzymes are pre-medicate 30 minutes before, and let the client know it may cause pain. My answer is, the motherfucking interventions prior are pre-medicate 30 minutes before, you gotta pre-motherfucking medicate 30 minutos before, and also you gotta let the client know that shit might cause pain. Number 119. What is the action of topical enzymes? The answer is, the action of topical enzymes is, it aids in the removal of pus and dead soft tissue, necrotic tissues from wounds. This is used in second and third degree burns and pressure ulcers. My answer is, just remember that the action of topical enzymes is it aids in the removal of pus and dead soft tissue and necrotic tissues from wounds and is used on top of second and third burns and obviously pressures ulcers since it topical enzymes. Get it topical. Number 120. What are the adverse reactions of topical enzymes? The answer is, the adverse reactions of topical enzymes are low incidence. It may cause mild and transient pain and numbness and dermatitis. Pre-medicate the patient 30 minutes before. My answer is, when you hear adverse reactions of topical enzymes, think of adding mild and transient pain and numbness and dermatitis, and remember to pre-medicate before. Number 121. What important action should you take regarding storage of antiseptic and germicidal agents in healthcare facilities? The answer is, the important action you should take regarding storage of antiseptic and germicidal agents in healthcare facilities is, do not leave medication at bedside. This is to avoid confusing clients from ingesting it. Antiseptics slows and prevents the growth of microorganisms. Number 122. What is the dermatological preparation commonly used when providing care to tracheostomies and decubitus ulcers? The answer is, the dermatological preparation commonly used when providing care to tracheostomies and decubitus ulcers is normal saline. Dermatologic preparation. Skin is the largest organ in the body. It forms a barrier between the outside environment and structures beneath the skin. It is subject to injury and trauma and changes. Skin diseases often give rise to an inflammation response. Swelling, redness and pain, blisters, hives, wheals or pustules may form. Rupture and form crusts, scales, scabs. Skin may flake or scale as in dandruff, psoriasis,